Hello friends, welcome back to our interview series. We are already on the fourth video of this series, and today we're going to discuss everything that you need to know to apply and prepare for a Band 7 First Contact Practitioner role. My name is Kurit Lane and I'm a physiotherapist working in the NHS, and on this channel we help students achieve their career goals and patients achieve their health goals. Preparing for an FCP role is by far the most, I don't want to say difficult, but lengthy preparation. What is asked in these interviews can vary so much, from very in-depth clinical questions to maybe just safety netting, triaging, signposting, and understanding the FCP role. But as a candidate, you need to be prepared for almost everything that can come your way. Preparation for an interview day has already been covered in our Band 5 video, and competency and values-based questions have been covered in Band 5 and 6 videos. So today we're going to dive straight into everything you need to know to prepare for an FCP role. So today's agenda is understanding the FCP role, preparing your personal statement for the FCP role, and preparing for the interview. To be eligible for an FCP role, you must have 3 years of postgraduate experience in musculoskeletal physiotherapy. Like I've always said before, the first thing to prepare in an interview is understanding the job role. A first contact practitioner is a diagnostic clinician working in a primary care setting, most commonly a GP practice. Your main job role is to diagnose and manage undifferentiated and undiagnosed musculoskeletal presentations. Being a first contact point, FCPs refer patients to GPs and other clinical expertise for medical management of non-MSK conditions and pharmacological management which is outside of their scope of practice. Being in this position, you are responsible for 3 main things: making high-level complex decisions to inform the diagnosis, investigations, management, and onward referrals of different conditions. Number 2 is identifying red flags, MSK masquerades, serious pathologies, persistent pain, and signposting and making appropriate onward referrals. Number 3 is identify and address frailty, misuse and overuse of medication, mental health issues, and safeguarding concerns. We have discussed making an impressive job application in our previous video. So today we're just going to discuss the important points that you need to add in your cover letter and your resume for an FCP job application. So we will go through some steps that you can follow to adapt your statement effectively. By now, you should have thoroughly understood the responsibilities and expectations from an FCP role. Adapting your personal statement to the role of an FCP involves highlighting and emphasizing all the knowledge, skills, and attributes that align with the expectation that comes for the role. For example, excellent clinical assessment abilities, advanced musculoskeletal knowledge, strong communication and patient education skills, the ability to work autonomously, and a commitment to ongoing professional development. Discuss any relevant workshops, conferences, or trainings that you have attended, as well as any professional memberships that you have, or if you have taken part in any research or audits. And along with using these adjectives, also give examples of how you achieve this. For example, in my clinic, I triage undiagnosed conditions on telephone calls. In my face-to-face clinic as a senior physio, I assess and diagnose conditions, and then I manage them in the gym or in review appointments. And for tendinopathies, I do shockwave, I run exercise classes. I can just go on and on and on, but you know what I mean. Just don't use words. Also give examples of how you are achieving this in your current job or in your current routine. Emphasize patient-centered care. Understand the importance of being the first contact for anyone who is approaching healthcare. So it is very important to demonstrate your commitment to providing patient-centered care. Discuss your approach to individualized treatment planning, patient education, and empowering them to take care of their own health and participate in its recovery. Discuss teamwork and collaboration. Describe your experience of working in a multidisciplinary team and your ability to cooperate and engage with people in cross professions. All of this to achieve excellent patient outcomes. As part of these competencies, you can complete a number of electronic modules that are available on the ELFH website. These are quite informative and free to use for all NHS employees. Mentioning these in your personal statement will give a very, very positive impression about how much you researched for this role and how you have fulfilled all the requirements to be qualified for it. Remember, your personal statement has to be well structured, concise, and to the point. It should effectively demonstrate your passion for the FCP role and why you are qualified for it. Now, let's move on to the third and final component of our agenda, the interview questions, and how to answer them effectively using the STAR technique, the Socrates method, incorporating the biopsychosocial model with real-life clinical examples. We will divide our questions into two categories, related to the FCP role and clinical questions. So starting with the questions related to the FCP role, you can be asked stuff like, you don't have any prior experience for an FCP role, why would you be qualified for this job? And you can answer this by saying how in your current job role you have progressed to prepare for this role, and think of the capabilities and requirements in the FCP roadmap so you can explain against them how you fulfill that criteria. What is your understanding of the FCP role and what challenges do you expect in this role? A thorough understanding of the FCP role will help you answer this question. An FCP is working in a primary care setting as a first contact for anyone approaching healthcare. Being in this role, the most common challenges are time management, safeguarding patients, advanced level clinical decision making, and working in a multidisciplinary team. And whenever you mention a challenge, don't forget to highlight how you cope with challenges. Look at them as a learning opportunity and a chance to work on your personal and professional development upon reflective thinking on what happened. How will you refer a patient to another specialist? This question aims to assess your communication with cross professions and other people in healthcare, along with your ability to recognize and decide when is appropriate to escalate the care of a patient. You should describe the criteria and the process of making a referral, such as identifying the appropriate service or specialist that you're going to send the patient to, writing a clear and concise referral letter with the goal of the referral. The referral should be a shared decision, the patient should be informed, and ideally should have consented for this referral. And like always, give an example of a case where you made a referral and with the reasoning of why you did it. For example, referring a patient with plantar fasciitis and bilateral flat feet to podiatry for their input and their review for the condition. How would you resolve a conflict at work? You can say that first of all, you would like to avoid all conflict by making sure that you're always clear and concise in your communication and value other opinions. However, if and when a conflict arises, you would like to resolve it by understanding the point of view of the other party and by compromising and reaching common grounds. It is best to give a personal example of what happened, who did you involve, what was the process of resolving the conflict, and what were the outcomes. You have a full diary and each patient has a 20-minute slot. The patient appointment in your diary is scheduled at 15:10 till 15:30. The patient arrives late at 15:25 and reception told them that you, the FCP, will be able to consult them anyway. Your next patient is scheduled for 15:30 till 15:50 and has already arrived. What do you do? I will invite the patient to my clinic and make sure that there was nothing serious that caused her to be late. I will then explain that we have only 5 minutes left till the end of appointment time, so we can make sure that there's nothing urgent or serious of concern today. And then I would like to offer to reschedule the appointment so we can have a full consultation and make a diagnosis and a plan for her. Later on, I would also like to discuss this with the reception, that what a good cutoff time for the appointment should be if a patient is late, because this would otherwise cause false hope and then disappointment at the patient's end and would also create a stressful environment for the clinician. How will you manage a patient with multiple comorbidities? Questions like these aim to test your problem solving and decision making skills in complex cases. You should describe how you would prioritize a patient's needs and goals, how you would adapt your assessment and treatment to their comorbidities, how you coordinate care within cross professions and in a multidisciplinary team. Approach the patient from a biopsychosocial point of view and safety net and address any complications or risks that you think might be involved. You welcome a patient into your consultation room that is upset and frustrated. The patient is convinced that physiotherapy cannot help his symptoms because he has seen a physio in the past for the same problem and his symptoms have not improved. The patient demands an MRI because he wants to be sure of what the diagnosis is. What would you do to meet the patient's expectations? You can say that you will communicate clearly by actively listening with empathy and educate the patient about the condition, its prognosis, and its management options. Explain that an MRI is not always absolutely essential to create a diagnosis, and given the signs and symptoms of the patient, it is very likely that we can create an accurate diagnosis based on a clinical assessment. Reassure the patient that it's a very positive sign that their signs and symptoms are not raising a concern and is nothing sinister that we are worried about would be underlying causing this problem. Explain how your practice is evidence-based and how evidence suggests that signs and symptoms like these can be managed using like a multidisciplinary approach, a biopsychosocial approach, and have very favorable outcomes even if the previous physiotherapy treatment was not very effective. Educate them about the multifactorial nature of pain and how physiotherapy can help them address some of these components that are causing pain and help them achieve their goals. What are some of the signs and symptoms that you might encounter working as an FCP in a GP surgery that can constitute an alarm or warning signs and symptoms that need patient diagnostic tests that suggest a potentially serious underlying disease? There are a few serious pathologies that require immediate attention, and a delay in diagnosis can have detrimental effects. For example, malignancy, infection or septic arthritis, inflammatory arthropathies, acute fractures or dislocations, neurological lesions, and vascular conditions. To screen for these conditions, don't forget to ask these following questions as a part of your subjective assessment. Mechanism of injury, onset, past medical history including cancer, any inflammatory conditions, screen dem, TB, HIV, intravenous drug use. Any weight loss, fatigue, malaise, night sweats, night pain, loss of appetite, sleep disturbances, history of steroid and antibiotic use, history of major trauma, any overuse syndromes, history of minor trauma with osteoporosis, long-term steroid use, alcohol or smoking, any recent infections, 5Ds, 3Ns, quota equina screening questions. A GP refers a patient to you for a first consultation, and by reading both the patient's previous notes and the note on the patient appointment, you understand that the patient was told by the GP that the reason of his symptoms and his diagnosis is bilateral Achilles tendinopathy. As you ask more questions and perform your examination, you realize that the diagnosis is wrong and the patient instead has bilateral plantar fasciitis and not Achilles tendinopathy. What do you do in this situation? Questions like these are aimed at understanding how you would maintain cross-professional relationships while maintaining patient satisfaction. You can discuss with the patient that in acute stages, conditions can present with very similar signs and symptoms due to the high irritability, severity, and nature of pain. You will reassure the patient that the GP referred you to a musculoskeletal specialist with a good differential diagnosis. And being in the position of that MSK specialist, you have further assessed the condition in detail, made your diagnosis, and reassured the patient about the condition and discuss what the management plan would be. How to motivate or enhance patient compliance with the treatment. Explain the treatment options available with the pros and cons of each option. Set realistic goals, make it fun, address the barriers, and tailor the program to the patient. Now let's move on to the clinical questions. As an FCP, you will see a variety of conditions in your caseload. However, in an interview, the most common clinical questions are to be based around the most serious conditions that you will be potentially seeing. The interviewer wants to make sure that you are able to identify these serious conditions because the health and safety of patient is of paramount importance over here. Some examples of very serious clinical conditions are Cauda-Equina syndrome, aortic aneurysm, cervical myelopathy, cancer, safeguarding concerns, thoracic outlet syndrome, giant cell arteritis, cervical red flags, any sepsis, or rheumatoid or inflammatory conditions. You can get direct or clinical scenarios about these conditions. I will give you some examples of clinical scenarios to give you an idea of what kind of clinical questions can come your way. A 45-year-old male patient presents to the GP surgery with a sudden onset of severe low back pain after falling on his back. The pain is going into both his legs. The patient reports that due to the severity of pain, he feels weak and unable to move. What additional questions will you ask, and what will your plan of action for this patient be? A 60-year-old female patient visits the GP surgery with complaints of acute on chronic neck pain. She reports in this acute aggravation she is also experiencing pain radiating down her bilateral arms. She mentions that she is feeling weak in her right hand grip and frequently drops objects. What additional questions will you ask, and what will be your plan of actions for this patient? A 65-year-old female patient visits the GP surgery with complaints of persistent thoracic pain. The patient has a known history of breast cancer, which was treated with surgery and adjuvant therapy 5 years ago. She reports that the pain is dull, aching, and has been progressively worsening over the past few months and is now affecting her daily activities. She is unable to find a comfortable position and is affecting her sleep. What would be your immediate concern for this patient? A 35-year-old female patient presents to the GP surgery with right elbow pain. She is cradling her arm and reports the pain started after she fell in the bathroom 3 days ago, and the pain has been getting worse since then. She has not been to A&E. On requesting to expose the arm for examination, the patient declines consent. You have offered a chaperone, but the patient declines that as well. How would you proceed? A 50-year-old male patient presents to the GP surgery with complaints of severe joint pain, swelling, and redness in his knee. The patient reports a sudden onset of symptoms accompanied by fever, chills, and overall feeling unwell. He mentions difficulty in moving the affected joint and experiencing significant pain with any weight-bearing activity. Given this information, what would be your first differential diagnosis? A 25-year-old male patient visits the GP surgery with complaints of chronic low back pain and stiffness. The patient reports that the symptoms have been present for several months and are progressively worsening. He mentions that the pain and stiffness are more pronounced in the morning and improve with movement and exercise. Given this presentation, what would you like to ask further? A 65-year-old male patient presents to your clinic with complaints of mild, intermittent abdominal discomfort for the past few weeks. The patient reports that the discomfort is mainly localized in his central abdomen and occasionally radiates to his lower back. He denies any associated symptoms such as nausea, vomiting, changes in bowel habits, or urinary symptoms. How would you proceed with this patient? A patient with high BMI and generalized osteoarthritis, most severely affecting his bilateral knees. The patient reports his knee pain has been flared up since a month due to the cold weather. He reports the pain is causing issues with normal activities, and he feels like he has given up on life and has cut himself off from friends. What would you do? This brings us to the end of not only this video, but also potentially this interview series. We are, however, contemplating on whether we should invite an ESP to our channel and pick their brains on how we can up our careers to a band 8 level. Is that something that you would be interested in? If so, let us know in comments below. It would also be helpful to know at what band level most of our followers are working at, so it helps us gauge what sort of content should we be putting out more. I hope that this video helped you understand the FCP job role, the structure of the interview, and how to prepare for it. All the best for your applications and good luck for your interviews, and I'll see you later. Bye!